Ooh, the comments on this one will probably be so juicy. So yeah, 3 things that I really hate that doctors do that I think should be GMCable offenses. Number 1, you doctor will go into the patient, talk to them for about 40 minutes about God knows what, the fall of the Roman Empire, I don't know. And then you'll come out to the nurse. You'll find them. You look at them without any remorse or regret or guilt in your eyes and tell them, so yeah, nurse, can you please do these patients' bloods? Thank you. Goodbye. What did you just spend 40 minutes with the patients for? What were your hands doing? Were they wrapped around your schlong? Could you not have just done the bloods while you were there for the last 40 minutes? And then you complain when the nurse calls you up from 3 wards away to prescribe emergency paracetamol. If you want to be a good doctor in my books, you take your patient's bloods before you go. Number 2, and this one kind of follows number 1, is when a whole gaggle of doctors will surround 5 patients, do their histories, do all the stuff, make plans, make prescriptions, and then leave without telling the nurses anything. Just expecting divine providence to come down on the nurses to tell them that you've just prescribed about 50 medications for 50 patients. I actually find this quite bad, quite dangerous, because if you don't tell the nurses that you've prescribed important medications for a patient or tell them that you're discharging someone or what the plan is, then they don't know and it can cause serious clinical delays. And don't get me started on the doctor told me that I could leave 3 hours ago. Why haven't I been let go yet? Well, they didn't tell anybody, that's why. And number 3, and this one pisses me off, it's when we do blood gases. And I have been guilty of this in the past as well. See, blood gases are a really painful blood test that we take from the artery in the wrist. The problem with this test is that the artery is usually much more durable, much more resistant to needles than a vein is. And sometimes it rolls about a lot. You can easily miss when you're doing an arterial blood gas. That means you could be literally there with a needle inside the patient's wrist performing Mozart's Third or something with the violin. And the patient's going to be in so much pain going like, and they can't move because if they move, it'll just make things worse. You can avoid all of that by just instilling 1 ml or 1 milligram of local anesthetic in the area you're going to put the needle in. Just avoid that whole thing. But they don't. And when they have to eventually abandon the attempt and try again, they'll just not look at the patient and go like, oops, sorry, that didn't quite work out quite well. Let's try again. The only reason why you shouldn't really put any local anesthetic around the artery you're going to, do the procedure in is if the patient's already dead and won't feel anything. Or if the artery is literally bouncing out, you can see it clearly. You know it's going to be an easy wham, bam, thank you, ma'am. But it almost never is. So please, put in some local anesthetic. The hospital's a bad enough experience for patients as it is. So yeah, that's that. Let's see the comments roll in now.